Maya Hernandez.
As vaccines slowly roll out, variant strains of the virus are popping up more and more in the U.S. We know we have the UK variant here. Vaccine makers are working to keep up with this. News 8's Lisa Carberg is here with more on that. Lisa.
And scientists and doctors tell us every day they're not surprised to see the COVID virus mutate because that's what viruses do. The question now is how quickly can drug makers tweak their vaccines to fight those variant strains?
What health experts know about vaccines' effectiveness on the dangerous COVID virus variant from South Africa is based on a small study with relatively young people. It shows a lower effectiveness. That more dangerous variant is now in the United States. Dr. Virginia Bieluch is the chief of infectious diseases at the Hospital of Central Connecticut.
Even with travel restrictions, people are traveling. There have been isolates in only a few states thus far. But yes, it will start to spread. Now, we've got to remember that we're vaccinating people with the Moderna and the Pfizer vaccines. These are very effective vaccines against the usual variant of COVID-19.
Dr. Bieluch weighs in on current vaccines on the market.
We do expect, based on some preliminary laboratory data, that they will not be as effective against the South African variant, but we will still expect to have considerable effectiveness against this variant.
Drug development continues at a rapid pace.
They know the genetic code for this South African variant, and I know that the manufacturers of the mRNA vaccines are working on tweaking the vaccine, maybe making a booster dose.
As variants multiply and we wait for mass vaccinations, Dr. Bieluch urges the usual precautions to remain safe and healthy.
Mask wearing, social distancing, hand hygiene will work against these variants.
And she says drug makers have the technology to make boosters fairly quickly. It's a process much easier than creating the vaccine. Lisa Carberg, News 8.